Opioid use disorder, or opioid use disorder, is a mental health condition that arises from a problematic pattern of opioid misuse. Opioid use disorder is characterized by an overpowering drive to use opioids despite harmful consequences. Opioids are a class of drugs that interact with nerve cells to reduce pain. They can create a sense of euphoria and numb both physical and emotional pain. However, this relief comes at a cost. Opioids are highly addictive. Over time, the body develops a tolerance, requiring higher doses to achieve the same effect. Opioid use disorder exists on a spectrum and can be mild, moderate, or severe. The severity depends on the number of symptoms a person experiences. Symptoms include a strong craving for opioids, difficulty controlling use, and continuing use despite negative consequences. It's important to understand that opioid use disorder is a chronic condition, not a choice. It is treatable, and with the right support, recovery is possible. Opioids include both natural opiates like morphine and codeine, and synthetic versions like fentanyl and oxycodone. While opioids are effective for pain relief, they can also lead to dependence and addiction. Dependence refers to the body's physical adaptation to opioids, often resulting in withdrawal symptoms when use is reduced. Withdrawal symptoms can include discomfort, pain, and intense cravings. Compassion and support are key to helping those affected by opioid use disorder. The pleasurable effects of opioids can lead to misuse. People may start taking larger doses or using them more frequently than prescribed. This can quickly spiral into an opioid use disorder. The addictive nature of opioids lies in their impact on the brain's reward system. When opioids bind to opioid receptors, they trigger the release of dopamine. Dopamine is a neurotransmitter associated with pleasure and reward. This surge of dopamine reinforces the drug-taking behavior, making it increasingly difficult to stop. Opioid use disorder has reached epidemic proportions globally. The World Health Organization estimates that over 20 million people suffer from opioid dependence and opioid use disorder. In the United States, the opioid epidemic has been particularly devastating. According to the Centers for Disease Control and Prevention, over 100,000 people died from drug overdoses in the United States in 2021 alone. Opioids, primarily fentanyl, were involved in the majority of these deaths. The opioid epidemic does not discriminate. It affects people of all ages, races, ethnicities, and socioeconomic backgrounds. The consequences of this epidemic extend far beyond the individual. Opioid use disorder has a ripple effect, impacting families, communities, and healthcare systems. People with opioid use disorder may show physical, behavioral, and psychological changes. Physical signs can include things like constricted pupils, drowsiness, slowed breathing, nausea, and even constipation. Behavioral changes might involve neglecting responsibilities, withdrawing from social activities, or engaging in, risky behavior. Psychological symptoms can encompass mood swings, anxiety, depression, and increased irritability. Withdrawal symptoms, though, can be particularly distressing. They often include muscle aches, insomnia, sweating, diarrhea, and those really intense cravings. It's so important to remember that these symptoms are a sign of physical dependence. They absolutely do not mean that the person is weak or lacking in willpower. So what causes opioid use disorder? It is a complex condition with multiple contributing factors. One significant factor is the overprescription of opioid painkillers. In recent decades, there's been a dramatic increase in the prescription of opioids for pain management. This, unfortunately, has led to greater access to these highly addictive drugs. Genetic predisposition also plays a role in opioid use disorder. Research suggests that individuals with a family history of addiction may be more vulnerable to developing opioid use disorder. Mental health disorders, such as depression, anxiety, and post-traumatic stress disorder or PTSD, can also increase the risk of opioid use disorder. People with mental health conditions may turn to opioids to self-medicate and cope with their symptoms. So what treatment options are available? There is hope for individuals struggling with opioid use disorder. Medication-assisted treatment, or MAT, is considered the gold standard for treating opioid use disorder. MAT combines medications such as methadone, buprenorphine, and naltrexone with counseling and behavioral therapies. These medications help to reduce cravings, manage withdrawal symptoms, and prevent relapse. Counseling and behavioral therapies provide individuals with the tools and support they need to address the underlying causes of their addiction and develop healthier coping mechanisms. Prevention is equally crucial in addressing the opioid epidemic. Efforts to prevent opioid use disorder include raising awareness about the risks of opioid misuse, promoting responsible prescribing practices, and expanding access to naloxone, a medication that can reverse an opioid overdose. It is essential to approach opioid use disorder with compassion and understanding. By reducing stigma, increasing access to treatment, and implementing effective prevention strategies, we can help individuals, families, and communities heal from the devastating effects of this epidemic. If you found this video helpful, please like and share it with others who might benefit from it. Be sure to check out our other videos.